Our next speaker is Dr. Raksha Bhide, and to introduce her, I have Barka Bhatnagar. I call upon her to uh, introduce Dr. Raksha Bhide, and then we'll call her over to do the presentation.
Good afternoon to August gathering. Dr. Raksha Bhide would be speaking about clinical yoga therapy for mental health. She holds a PhD in clinical yoga therapy and mental health from Dept of Psychiatry, NIMHANS. She specialises in clinical yoga therapy for mental and maternal mental health and has served over 1,000 plus clients. As a researcher and a therapist, she is passionate about integrating clinical yoga therapy with scientific research to make a difference in an individual's holistic well-being. She has founded Dhi Life as a holistic mental health initiative. She is passionate about holistic integration of yoga philosophy from ancient texts with yogic practices as a complementary therapy for her clients. She holds a double master's in psychology and yoga therapy M.Sc. Her interests include Indian psychology, integrative medicine, spirituality, and Indian classical music. She has over 10 national and international publications on yoga and mental health. She has interviewed by NDTV India. She has been interviewed by NDTV India for promoting yoga for mental well-being during C19 COVID-19 lockdown. She believes that art has a huge role in our emotional regulation and mental well-being. She is a trained classical vocalist, plays the Indian flute, and integrates music into her therapy sessions. She is interested in spoken poetry, and her writings are a reflection of raw perspectives drawn from her life experience or from stories of her clients. Being a passionate dancer and a singer, and myself a yoga practitioner, I really look forward for this session. Please, ma'am.
I'll pull up your deck. Do you need a hand mic? Yeah.
Audible? Yes. I think the last session before lunch, and I'm very grateful to Vijay here for having me over. We met 2 years back at a similar conclave. And yes, thank you for sharing so much. I think a lot of you before me have spoken about your lived experiences, and it's been very moving. And like Neha was talking about bringing different kind of therapies together. Clinical yoga therapy is one such clinical model which is integrated in mental health care, and I'd like to speak more about it today so we understand what it is. So before we move into that, I think generally what yoga is. Alright, this is largely understood, and the first thing usually that comes to our mind when anybody says yoga is physical practice or exercise or an asana. That's usually what we understand yoga as, and it's largely promoted, right? But when we speak about yoga, yoga has 8 components traditionally, Ashtanga yoga, and asana is one limb and one part of it only. Right? So there are a lot of other components that come around with it. Starting from yama niyama, which basically means our ethical code of conduct, how we should be or in our day-to-day being, right? Having it also talks about introspection, of having a clean state of mind, what we could do for self-care measures. Right? It moves on to asana, that's physical body movement. It has components of pranayama, that is breath work. Right? And it has these other 4 limbs that are there. The pratyahara, dharana, dhyana, and samadhi are more introspective work and internal journey. So traditionally, yoga has these 8 limbs, right? And all of these limbs are important. But now, okay, let's look at what clinical yoga therapy is, because clinical yoga therapy is again very different from a general yoga class, right? Because now what I do with my work is I specialize in taking sessions for people with mental health conditions or for people going through different mental health conditions, right? And often, so this is the comment that comes in, right? So if a psychiatrist recommends yoga, then they say, there is a yoga class next to my house and I will go there. For somebody who is hale, healthy and who is okay, it's great to go to a general yoga class. But if somebody is going through a mental health condition, then there are certain precautions and cautions that have to be taken care of, because it needs somebody who understands mental health as well as therapy of clinical yoga, both together to come together, right? Because I need to work with you. It's similar to somebody going through diabetes. If you're diabetic, you walk through a clinic, they understand what's going on with you, right? They understand your physical composition. They say, okay, insulin is down, I need to work with you, I need to fix your diet, I need to bring in medication. Similar with mental health condition, if somebody walks in with anxiety into a yoga class, then I need to have a structured framework to see how I can help with anxiety, right? So it needs somebody who understands the medical component of it. It needs somebody with a training of that. And it also requires us to be mindful of curtailing and tailor-making that program for you, right? So if somebody walks in with anxiety and I say, sit quietly and meditate, it will not work. It's going to be a downward spiral, and it's only going to make it even more complex and bad for that person. And most of the yoga teachers might do that. If they're not qualified and you say, I walk in with anxiety, they say, you know what, just sit quietly and let's go into meditation, which would be very contraindicative. So it's important for us to understand this and know the difference between clinical yoga therapy and a general yoga class, right? So apart from that, so now I think another important thing that is something that I have researched on is also that largely yoga is understood as exercise, right? And this is not the case, because yoga is very, very in-depth and profound. So my research work at NIMHANS was also looking at how yoga can be integrated into a counseling model. Because yoga talks a lot about mind, about stress, about how to handle this on a day-to-day situation. And there's a lot of rich philosophical backing that could be translated into applying it in our day-to-day lives, right? And this is something that I was exploring as well. And okay, so as all of you have spoken, I think so many of you came in here and were vulnerable enough to share everything that you were feeling. And these are feelings that we all go through, right, at different points of time. Maybe even as a caregiver or a person with lived experience, we're going through these emotions. And let's take a look at what happens. Now, there is a very close association with my mind, with my breath, and my body, right? So let's take a look at what happens. Now, let's say you are feeling really joyous. Let's say you've gone on a hike, or maybe you love the mountains, and you're there. And what tends to happen to your body when you're there? Well, how does your body respond?
Exhale.
Exhale, okay, beautiful. And what happens maybe with your arms? Like this person is there.
Outstretched.
Yeah, you're opening, you're saying, wow, let me take in that fresh air, I'm going to open up my body, which is very natural. You're not telling your body do this, right? You're out there and you're feeling joy, and you notice that your chest is becoming open, you're becoming, you want to breathe better, and that's what happens with your body's natural cue. When you're feeling really tired, let's say you're feeling drowsy, and we take a yawn, what happens to our hands? What do? You stretch out. You say, I need a little more oxygen. Body is giving you these cues without you having to compel your body. So we know that my mind has a reflection on my body. How I feel is translated onto my body, right? Similarly, now let's say that you're feeling very sad. You're feeling down, right? What happens, like the second image there? What tends to happen when I'm crying, when I'm feeling really low? I tend to go in a corner and maybe I cut myself down, right? This is also my body's intelligence telling me that I need to protect myself. What is here in front of my body? My heart, right? My respiratory system. Now it's telling me that it's not working to the fullest. I need to be compassionate, so I'm going to be that. So my breath rate decreases, my heart rate goes down, right? Again, body's cue telling me that this is how my mind is feeling and this is what the body does. Yeah? So we know that the body is connected with my mind. Yeah? So then what happens with the breath and the mood? Very similar, right? Now let's say that you're very angry. Have you noticed how you're breathing? How is it? Fast, heavy, yes. So I know that my breathing again is a reflection of my mind. Now again, let's say that you're sitting having your nice cup of tea in the evening, right? Maybe looking at nature, then how is your breath? Have you noticed how you're breathing? Slow. Anything else? Calm. Yes. Relaxed. Right? So I know that again my breath is a reflection of my mood. Now if I tell you, if you're going through a lot of stress and I say, you know what, don't feel stressed. Don't feel angry. Nobody can, go and fix how you're feeling immediately. If I say, don't think of an elephant, you've already thought about it. Right? Very difficult. I can't go and change how I feel immediately. But what can I do? I can use these two very powerful tools. I can use my breath, because as soon as I start working on my breath and I start slowing it down consciously, it will automatically reflect in how I feel. Right? Similar with my body. If I start opening my chest more, if I start working on maybe body work that enhances my breathing capacity, then I know it also helps me feel better mentally. Right? So these are the two key concepts that we use in yoga therapy as well, to understand the body and the breath and use it to access the mind, because I can't immediately go and change how I feel. Yeah? So then what happens? Let's look at clinical yoga therapy for bipolar disorder. Again, there is evidence, there is a lot of research that is being done to see how it is going to impact, how it helps in regulation. But we have to understand that there are different phases, right? There could be a phase of depression, there could be a phase of maniac, there could be anxiety associated with it. So curtailing the practice based on where you are, where your needs and symptoms are important. And for that, somebody who understands this journey and an expert in that journey is also important. Right? Because we have to also take care of the precautions. Now, I think as few previous speakers were talking about the role of brain and changes in the brain when it comes to these mental health conditions. Right? We've seen in research how this is also impacted. So, yoga therapy, we've seen it enhance the functioning of amygdala, like she spoke about, right? The fear center. So we've seen practices where the amygdala is deregulated, which means that your sense of anxiety and fear comes down. We've seen it enhance hippocampus. We've seen it reduce anxiety. Right? We've seen it reduce inflammation, parasympathetic tone is enhanced. Right? So there's a lot of research that is being done currently that has shown us results like this. And these are just few of the research studies that I've quoted here. So we've seen it's actively done right now, and we're testing out how it is feasible and acceptable, right, for people, and it's safe for people to practice. Now, based on this whole thing, like I spoke about, yoga is not just physical practice, it also has components of counseling, about the mind, about lifestyle intervention, mindfulness, and this was something that I was researching on for a good 5 years at my time at NIMHANS, and this is a program that is all encompassing, where I would like to tell you that yoga is more than just physical practice. Right? It's a day-to-day philosophy that we need to live. Okay, so I would love to invite you all to do this practice with me today. We'll do a few of these practices and see how we feel. Right? So we've been sitting for some time now, and it's before lunch, so good time for us to do. I would request you all to sit straight. If I could get a chair. I'll take this. Take it. Yes. Alright, so as you're sitting, I request you all to, if you can, take your shoes off, if that's comfortable, then you can take your shoes off. Place it on down. sit comfortably with your spine resting on the chair. So support your lower back onto the chair, sit nice and straight. So you can keep your palms open on your thighs. Wonderful. And softly close your eyes there. Take a moment, close your eyes. Now as you're sitting, I want you to move your awareness from the soles of your feet. Just become aware of the sense of touch onto the ground. And from there, move your awareness to your legs, the lower back of your sitting bone. From the sitting bone, I want you to imagine a thread moving through the whole of your spine. And imagine a two-way force of this thread from the base of your spine. Imagine this thread pulling you down to the ground, to the chair. And from the crown of the head, imagine this thread is pulling you up to the roof. So there's a nice two-way force of this thread that is lengthening your spine. The spine is becoming taller and taller. Don't change anything. As you're sitting with the spine becoming taller, just notice how you're breathing today at this moment. You're not changing anything. Just notice the breath moving in and out. Maybe just by bringing awareness to your breath, you may notice a shift in how you're breathing, which is the power of awareness. And as you stay there, just gently taking your awareness to the mind, preparing for today's practice. We're just going to enjoy the next couple of minutes, breathing fuller, staying connected with our own breath and body. Setting that as the intention. Let's take a nice and deep breath in through the nose and exhale through the mouth, like blowing out a candle. Wonderful. One more time, we'll take a nice and deep breath in through the nose and exhale through the mouth, like blowing out a candle. Beautiful. From there, eyes gently open. Alright, so let's come up to standing. So as you're standing, we're just going to interlace our hands really to the chest here. So every movement that we do is with breath, right? And don't hold your breath at any time. You're going to do it absolutely comfortable, whatever pace you're comfortable with. So we're going to...
Should I hold the mic for you when you are doing this? Will that be okay?
Am I loud enough?
Yes.
Yes.
I think then you'll be heard till then.
Okay, yeah. Alright, so we interlace our hands, bring it to the chest here. Right? And as you inhale, I want you to lift your arms up, fully breathe in, biceps touching to the ear. Nice. As you breathe out, slowly bring the hand down, bring it back onto the chest and release it down. Super. Right? So let's do this continuously. So inhale, lengthen your spine, breathe in, lift your hands up. And as you exhale, slowly bring the hands down, collapsing it onto the chest. Beautiful. So inhale, let's lengthen, stretch out, breathe in, beautiful. Exhale to slowly bring the hands back down, collapsing it onto the chest. Inhale, let's lengthen, breathe in, lift up all the way. Exhale, slowly and gently back down. Wonderful. Last round. We inhale and stretch all the way up, breathing in. Exhale, slowly and gently down, release it onto the chest. Release your hands down now. Feet slightly apart. Let's immediately close our eyes. Just take a moment. Take a moment here and observe, see if you feel any difference at all. Maybe in your body, your arms, maybe in your breath, around your chest region. Just stay with that. Breathe, relax. Eyes gently open. Nice. Okay, so for the next practice, we're going to spread ourselves a little wider. So like we discussed the opening of the chest, right? So we'll do a practice where we experience that. So again, we're going to bring our hands closer to each other here, right? Inhaling, you're going to open your arms like you're going to hug somebody, breathing in, right? And as you breathe out, you're going to slowly bring the hands back together, bringing them closer and together. Yes? So as you inhale, you're going to open your arms, spreading it wider like you're going to hug somebody. Awareness is on the chest. Exhale to slowly bring the hands back together and relax. Beautiful. Inhale, open your arms, open your chest, breathe in. And as you exhale, bring the hands closer and together. Inhale, open your arms, breathing in. Exhale to bring the hands closer and together. One more time. Inhale to open your arms like you're hugging somebody. Breathe in. Exhale and together. Beautiful. Release the hands down. Again, quickly let's close our eyes for a moment. Just become aware of any changes. How is your chest feeling? Become aware of your arms. How is your breath? There may or may not be a difference. Let's just be mindful. See if you feel anything.
It's more regulated.
More regulated. Wonderful. Beautiful. Relax. Eyes gently open. Super. Alright, let's come down to sitting. Okay, so here's another practice that we will do in terms of the body closing down. When I said in terms of anxiety, this could be a really quick practice that we all do together. So when you're sitting down, right? So we sit down this way, and I'm going to inhale as I am. And as I breathe out, I'm going to go down. So I'll just show you how this works. So my hands are on my thighs. So I breathe in here, and as I exhale, I go down. My stomach goes down, my chest goes down, and finally my forehead goes down. Right? So as I breathe in, I lift my head up, my chest up, and my abdomen. Yes, so this is great in terms of if you're feeling a sense of anxiety or stress, so it immediately helps us to ground ourselves. And we could just do 2 rounds of it and see how we feel. So you can sit forward on your chair, right, feet on the ground, and give enough gap between your knees. Right? So we breathe in as we are, hand is on the knee. As you exhale, you're going to slowly go down, abdomen goes down, chest goes down, and finally your head goes down. And as you inhale, lift your head up first, look forward, and then your chest comes up, and then the abdomen. Exhale here fully. Beautiful. One more time. We take a nice and deep breath in. Now exhale, slide your hands down, abdomen goes down, chest goes down, and finally your forehead down. As you breathe in, first lift your head up gently, then your chest up, and then the abdomen. Exhale. Super. One more time. Take a nice and deep breath in. Exhale, slide your hands down, abdomen goes down, chest goes down, and finally your forehead down. Inhale, head up, chest up, and the abdomen. Beautiful. Relax. Sit back on your chair. Take a moment, palm facing upward. Sit back. Nice. And just stay there, observe your breath. See what happens. Your breath would have naturally slowed down. Relax. Staying as you are. You're going to just stay there for a couple of rounds. You can stay with your eyes closed if you're comfortable, and we're going to go ahead with a few practices with the breath. If you have any discomfort, feel free to open your eyes and look at me. So as you're sitting, sit with your spine resting onto the chair, palm facing upward, eyes softly closed. And we're going to bring all our awareness to the tip of the nostrils. Don't change anything. All awareness to the tip of the nostril. And I want you to start tracing the path of your breath. Just become aware of your breath flowing into the nostril as you're breathing in. and slowly trace the path of it through the throat, reaching all the way to the lungs. And as you exhale again, bring your awareness from the lungs. Trace the path of the breath moving out through the throat, through the nasal cavity and touching your nostrils as it's coming out. You're just going to continue to do this for a couple of rounds. All awareness with your breath. Inhale, trace the path of the breath as it touches the nostrils, goes further down through the nasal cavity, the throat, going further all the way down towards your lungs and your chest, maybe further down to the belly. And as you breathe out from the belly, the breath moving out up to the chest, throat, nasal passage, and brushing through the nostrils. And if you're making this your last round, after you completely exhale, relax. Eyes gently open. So another safe pranayama for us to do at any time is Anulom Vilom or Nadi Shuddhi pranayama. This is pretty popular, so I think a lot of you might have done it earlier. But we'll do a couple of rounds of this. This is great for emotional regulation and can be done at any time of the day. Right? So the only thing to keep in mind is if you've had a heavy meal, then give a gap of about 40 minutes. But other than that, you're good to do it at any time during the day. Right? So what we do for Nadi Shuddhi pranayama, we take the first is the right hand up, and we close the first two fingers to form this mudra. So we use the thumb and the ring finger. Okay? So with the thumb, I'm going to close my right nostril. And I'm going to first exhale fully through the left and start breathing in through the left nostril. Now close the left nostril with the ring finger and breathe out through the right. Good. Now from there, inhale through the right again. Close the right and exhale through the left. This completes one round. So after every inhalation, we change the nostril. Let's continue to do this. If you're comfortable, you can keep our eyes closed. So inhaling through the left, closing the left to exhale through the right. Then again, inhale through the right, closing the right to exhale through the left. Let's breathe comfortably at your own pace. Slower the better. Enjoying that slowness of the breath. And there's no sound while breathing. So if there's sound, it means that you're putting in effort. Let the breath be effortless. Enjoy the slowness of your breath in and out. Keeping the breath continuous. Without forcing the breath. Making this your last round. After exhaling through the left nostril, we will gently stop the practice and release the hand down. Keep your eyes closed. Keep your palms facing upward on the thigh. And just become aware of your breath here. Notice how you're breathing. Is the breath a little more relaxed, steady, slower? As we stay there, let's go in for the next practice, which is the humming wheel breath or Bhramari. So again, an excellent practice to immediately ground ourselves. So what we're going to do is we're just going to breathe in through the nose, and as we exhale, we're going to do this humming sound. Okay? And as we do that, I want you to just keep your awareness around the face and head region and see how you feel. Right? So we're going to take a nice and deep breath into the nose. Inhale deeply. Breathe in. Last round, let's breathe in. Relax completely, just stay there for a moment. See if you feel any resonance, any sense of vibration around your face and head region, or any part of the body, allowing you to relax further. As you go deeper and heavier into that state of relaxation, from the state of mind that is more centered and calm, we're going to make an affirmation or a sankalpa. An affirmation is a short, positive statement that you want as a goal for yourself. Something as simple as, I am completely healthy and happy. Or I am completely calm, centered, and confident. Any statement that you connect with, I want you to repeat the statement mentally with complete faith and surrender. And we're not just mechanically saying these words, we're repeating it with intention, feeling the essence of these words. Feeling that sense of calmness, confidence within you. If you believe in a higher power, a higher energy, then offering this on to that higher energy. Otherwise, to the center of your heart. Let the repetition slowly fade in the background. And slowly come back and back and back to connect with our breath. Just notice how you're breathing now. As we come towards the end of today's short practice. When compared to how we started to now, see if there's any difference at all in how you're breathing. Also becoming aware of your body. If there are any changes that you're feeling, just make a mental note of it. The breath might have become slower and deeper, and see how the breath is a mirror of the mind. As the breath becomes slower, the mind is also more relaxed and calm. So is the body, more energized. Whatever changes that you're feeling now, let's accept it wholeheartedly with a nice and deep breath in through the nose. Exhale through the mouth like blowing out a candle and let go. Inhaling, accepting all the changes wholeheartedly. Exhale to let go of things not in control. Breathing out through the mouth. One more time, breathing in, accepting all the changes, and exhale to let go. Let's bring our hands together, just wrap your palms together as one. As you generate a little bit of heat, place it over your palms. And slowly, as you open your eyes with a few blinks, look into your palms. Okay, thank you. Thank you. Okay, so I think if not anything also, this is like a simple toolkit that you can practice at any time. Especially the humming deep breath, it can be done at all times, even at work. So one of the clients that I had said that she started practicing this during her working hours. Right? And she said that whenever she would feel anxious, she would just sit in her cabin and practice the humming deep breath for 9 rounds. And slowly what started to happen also was her colleagues started coming in, and she said first I was feeling very reluctant to do it, what if people heard. And now slowly, so before lunch, so all of them get together, about 5 of them at their desk, and we practice it together. Right? So small, simple things, I think, brings about so much of difference. And now it's become a thing at their workplace. All of them gather together before lunch to do this as a short thing. So Brahmali is an excellent tool to take back to. You can practice it at any time during the day if you're feeling anxious. And the other things that we did as well today, just the hand stretch breathing, right? If you're feeling low in energy, that's something you can do in the day. So I hope that there's something that you could take back from right? Simple practices, but it would be very effective. Yes.
The previous slide.
Previous
Water.
By the way, Meera Shri Kumar is very much part of our community and a very dear friend, and also on the core team like Nandita
On Let's Walk Together Livelihoods Initiative. Isn't that small world? Right? Yeah. Okay. So Meera has benefited a lot under doctor's care, her therapy, yoga practices, and she's been sharing that with me as well. Yeah. Right. So let me share this. So the thing is, why we thought that this was essential. There are many many of the we know about yoga practices, but what is safe for mental health? Where people are living with severe conditions. What are the safe practices during episodes, out of episodes? What are the preventive practices? I think it's important to bring in a practitioner who has this kind of academic background and also in her own practice. I think this has been great value addition. Would you not all agree about that? Yeah, Raksha. Thank you so much. Yeah. By the way, I myself am alive today without any exaggeration because of my pranayam practice. I have been in intensive care thrice because of my acute asthma. And this has salvaged me. So I owe a lot to this practice, and I firmly endorse it to anybody who would want to take it up. Not only for a particular disorder, but general well-being. Yeah, right.
Absolutely right. Not just in treatment, I think it also in mental health care, right? And also as caregivers. I think it
Yes.
has a lot of impact on caregivers as well. Thank you so much.
Not at all. Is
Dr. Vani around here, sitting here? Yeah, may I call you to please present a token of appreciation to our, by the way, I bring in two NIMHANS pass outs together. Okay. Yeah, isn't it? Yeah. Thank you so much, Raksha.